anal that way. Okay? This will be for packing and for if anything is dripping down his buttocks after I irrigate it, I might want to just pat it dry. So I'm going to use what's in here for patting dry and for packing the wound. Okay? So I'll be doing what? Drying and packing or irrigating first?
Irrigating.
Okay? You can move your table. It's fine. You can do that in real life. And only for this, we're just going to use a surgical and a 4x4. No nonstick on this one, okay? And a culture tube. Love me in the hospital. Okay, we're going to take a culture. Now, again, who you're practicing with and whose demo they saw. Some people just kind of peel it down and throw it on. I find I cannot do that. When I throw it on, it just goes and goes and goes. It goes on the floor. So I can hold it underneath, hold the tube, peel it open, okay, and then just pop it on, right? If you throw it, depending on what strength you have, it'll just keep on going, right? And sterile gloves. You can support the bottom there and up, and anything you have to fix, okay? Irrigate first. I have to hold the basin up when I irrigate, so this hand is now going to become, my non-dominant hand will be contaminated. Because I can't just do this, it's just going to flow everywhere. I want to direct the fluid into this basin, okay? Irrigate, and you're going to keep doing this keep flushing it until it runs clear. And there's no more contaminants coming out. Okay? And just leave that there for now. I wouldn't even risk bringing that towards here and contaminating anything. Okay? Contaminated, sterile, pat dry if you have to. Okay, throw it away. Culture. Contaminated, sterile. So if I do this, I want to use this hand. Pick up the tube first, transfer it to the other hand, take out the top, pick up your culturette, take your specimen, put it inside, seal it, squeeze the bottom. It's got the little substance in there to keep it alive until it gets to the lab, okay? And then just get it out of your way, okay? Now, packing. You pack it loosely, don't pack it too tight. You want it to be able to breathe in there, You don't want it to pack too tightly. 4x4, once I cover the wound and it's covered, then I can use my other hand, there it goes, to hold that on, okay, and my surgical or non-core abdominal dressing. And then tape. All right, before you do anything else, you're going to make sure your patient is, before I clean up, what I want to do for my patient. Make him comfortable. Okay, he doesn't need this anymore, get rid of that. Make him comfortable, reposition. You really should change his position every 2 hours at the most. Okay?
So should you have written date and time before you, when do you write date and time on that?
When I'm cutting my tape, I can do the date and time. Same thing at the other wound. While I'm setting up my supplies, before I put my gloves on, just take a piece of tape and write date. I mean, starting at 9 o'clock and you don't have to put it on until 9:30. It's not. It's still an idea, okay? Make them comfortable. Clean up. This is going to go into the toilet bowl, not the sink. And don't throw this full into a garbage bag because it can have a hole in it. So just pour the fluid into the toilet, flush it, then the basin can go into the garbage, okay? Clean everything else up. Take off your gloves, garbage. Wash your hands. This should be put into a bag and labeled and down to the lab within half an hour, okay? And then go and do your nurse's notes. If you're a really quick nursing note writer, then by all means, go write your nurse's notes and then get that to the lab. But it's better to just get this to the lab and then go do your nurse's notes. Okay? And that's it.
Can I ask a question? The folded photo you used to pack, how come that wasn't always sterile?
I don't need it. It's got its own little sterile container. So I don't have to. The other ones won't stay open. I want to get that. But this stays very nicely. It's a little sterile container and won't have to go on the on there. Okay?
At what point do we measure it?
Do you know how to do it?
Oh, thank you. I'm sorry. I forgot about that, didn't I?
The what?
When you take the dirty dressing off, when you still have your clean gloves on, then just measure it. If you don't have that, you can eyeball it. You have an idea what a quarter looks like, what centimeters look like, or you can have a Q-tip. You don't have a measuring device, you can bring in a sterile Q-tip and just pop that out of the package and measure the depth. Okay? So when you take the dirty dressing off, then you'll measure it.
Okay.
Then you take off your gloves, throw away your red bag.
What is this measuring for?
This side.
Well, no, why
Um,
you
To see if it's getting better.
Right, if I have a hole this big, I want to place this against the wound, and I'll say that it was, I can't read this, I can't see a darn thing. You want to write down what the number is. So say it was 2 today. I go to my nurse's notes and I found that it was 1 yesterday. Then it's a problem. Opposite. If it was 3 yesterday, it's 2 today, then we're happy. Again, I had it in my head what I want to tell you, and I can't remember what that was. I'm going to remember as soon as I leave. That's pretty much, that should be it, I think. Just come in and practice. After you practice with this, if this is now folded exactly the way it's folded now, that's when it's going to give you a headache. And that's one of the secrets to opening it up the right way, is that it goes in the same way it came out. Sometimes you try it, the folds aren't precise, and maybe you fold it up a little bit different, and then you go to open up your package, and it's just not cooperating. So just come to us, and we'll refold it for you. I could do it in my sleep now. Okay? I went here. I graduated from here. I had to do the same skills that you're doing. Nobody was more nervous than I was, so I understand. I know the difference between being nervous and not coming into practice. Okay? If I see you every day and you're in here and then we get to the skill and you're just having an anxiety attack, I understand. I will calm you down. Okay? If 3 weeks go by and I've never seen you before and your packages are not open and you don't know it, then it's different. Okay? Then I won't calm you down. I'm going to yell at you. All right? So I know the difference between being nervous, because no matter how prepared you are, you can know everything 100%. You get up there and someone's staring at you doing it, and all of a sudden everything just flies out of your head. So believe me, all right? I understand that. So don't.
Thank you.
Okay? And that's it. So do you want to take a break?